41,000 people die from falls every year after age 65. 14 million Americans over 65 fall at least once every single year, making falls the leading cause of injury-related death in that age group. Whether you fall, whether you recover, and whether you keep living on your own terms comes down to one thing: the strength in your legs. What we are covering today is exactly what happens to your leg muscles after 60, why the standard squat may not belong in your routine, and what clinical research says you should do instead. Every exercise in this video has been tested in trials, endorsed by physical therapists, and proven effective in people well into their 80s and 90s. Stay through the entire video because at the end, I will walk you through a 4-phase plan you can start this week. Something quiet and invisible starts happening inside your muscles after age 30. A slow decline of 3 to 8% of muscle mass per decade that most people never notice. After 50, that rate climbs to 1 to 2% per year. After 60, the losses turn sharp. Longitudinal data from the Health, Aging, and Body Composition Study showed thigh lean tissue dropping roughly 10 to 12% per decade in men and 6 to 9% per decade in women after age 70. And by age 80, some individuals had lost up to half of their total muscle mass. But here's the part most people miss completely. Strength drops far faster than size. Between ages 50 and 60, strength declines at about 1.5% per year. Cross that 60-year threshold, and the rate doubles to 3% per year. Researchers on the Health ABC study described the gap between mass loss and strength loss as surprisingly much greater, their exact words. Longitudinal analysis of adults in their 8th decade documented upper leg torque falling 27 to 38% in just 10 years. What drives that gap between size and strength is the selective destruction of fast-twitch muscle fibers. Between ages 20 and 75, more than half of your type 2 fibers disappear, and these are the fibers that fire when you stumble and need to catch yourself before hitting the ground. That atrophy concentrates in the quadriceps, the exact muscle group responsible for walking, climbing stairs, and standing from a chair. About 30% of adults over 70 already struggle with those basic tasks, according to the National Institute on Aging. Steps per day drop 75% between ages 60 and 85, while falls per step increase by 800% between young adults and 90-year-olds. Gait speed, which researchers use as a diagnostic marker, falls below the critical 0.8 meters per second threshold in many older adults, signaling increased mortality risk. This condition earned a name in 1989 when researcher Erwin Rosenberg coined the term sarcopenia to describe age-related skeletal muscle loss. It now affects an estimated 10 to 16% of all adults over 60 worldwide, and in 2016, it received its own disease classification code, a formal recognition that this is a medical condition, not just normal aging. The European Working Group on Sarcopenia has established it as a clinical syndrome often overlapping with frailty syndrome, another condition that dramatically increases fall risk. What is at stake here goes well beyond fitness goals or how you look. Leg strength after 60 directly predicts whether you live or die and whether you spend your remaining years independent or in a care facility. A 2006 study by Newman and colleagues in the Journals of Gerontology uncovered a finding that reshaped how researchers think about aging. Strength, not muscle mass, predicts mortality. For every standard deviation decrease in quadriceps strength, death risk climbed 51% in men and 65% in women. A later meta-analysis, pooling roughly 2 million participants across 38 studies, confirmed that higher knee extension strength tracked with a 14% lower risk of dying from all causes. And the 2025 Clinimex Exercise Cohort Study, published in the Mayo Foundation for Medical Education and Research, pushed that finding even further. Muscle power, which measures how fast you can produce force, turned out to be an even stronger predictor. Among nearly 4,000 participants, men in the lowest power category faced a nearly 6-fold higher mortality risk compared to those at the top. Among women, that gap exceeded 4-fold. Lower extremity weakness carries an odds ratio of 1.76 for any fall and 3.06 for recurrent falls across a 13-study meta-analysis. Guralnik and colleagues published data in the New England Journal of Medicine in 1995 showing that older adults with the lowest lower extremity performance scores faced a 4 to 5 times greater chance of developing disability within 4 years. Falls cascade into worse outcomes from there, often leading to hip fractures, which carry their own devastating mortality rates. Research in the New England Journal of Medicine found a single non-injurious fall carried a relative risk of 3.1 for nursing home admission, and a fall causing serious injury pushed that number to 10.2. $80 billion. That is what non-fatal falls among older adults cost the healthcare system in 2020, with Medicare absorbing over $53 billion of the total. Fall death rates among adults 65 and older climbed 21% between 2018 and 2024, and that trajectory shows no sign of reversing. If leg strength matters this much, the natural instinct is to start doing squats. After all, the squat is considered one of the best leg exercises ever designed. The answer to whether seniors should use it turns out to be complicated. Research in the Journal of Orthopedic and Sports Physical Therapy documents how patellofemoral joint reaction forces and stress climb with greater knee flexion, peaking at 90 degrees during a squat. Adding just 35% of body weight as external load amplifies that stress between 45 and 90 degrees of flexion. Training in the 0 to 50 degree range minimizes knee forces and fits rehabilitation patients far better. For seniors living with knee osteoarthritis, and that includes a huge portion of adults past 60, squatting loads cartilage surfaces in areas that simply cannot handle it. A Mayo Clinic and Boston University MRI study of men with knee osteoarthritis tied squatting exposure to worse cartilage condition, especially at the patellofemoral joint. Aging bodies also face specific biomechanical obstacles that younger lifters do not. A 2024 clinical perspective flagged two dominant errors in older adults performing squats: excessive lower back arching that strains discs and facet joints, and inward knee collapse that accelerates osteoarthritis. Normal ankle flexibility in older adults sits around 11 to 12 degrees, but a proper back squat demands 30 degrees or more. That deficit forces compensatory patterns that redirect stress onto the knees and lower back. Balance adds another layer of risk. For deconditioned seniors, a squat demands simultaneous coordination of the hip, knee, and ankle through alternating muscle contractions, which creates a fall hazard during the exercise itself when done without support. Now, fairness matters here. A 2024 scoping review of 15 studies found 87% of them concluded deep squatting is safe with submaximal loads in individuals who have no underlying joint conditions. Squats are not inherently dangerous, but the reality is that most adults over 60 carry at least one joint condition, balance deficit, or deconditioning factor that turns standard squats into a problem without heavy modification or direct supervision. Physical therapy researchers have stated directly that the leg press is preferred over a free weight squat for older adults because technique does not limit load intensity the way a free squat does. Which brings us to the exercises that deliver the same benefits with a far better safety profile. 4 categories of exercises have earned strong support in clinical research for adults over 60, and each one can be done at home. First up, the sit-to-stand exercise, the single most studied squat alternative for seniors. A 2019 study in experimental gerontology enrolled 14 frail adults aged 75 to 88 in a 12-week program, 3 sessions per week, and knee extension strength rose from 1.07 to 1.31 Newton meters per kilogram. A 2007 randomized controlled trial tracked 66 mobility-limited adults over 80 and recorded statistically significant gains on the Berg Balance Scale. What really turned heads was a 2023 randomized controlled trial of 60 participants that showed just 8 weeks of sit-to-stand training improving muscle quality index by 40 to 45%, relative power by 29 to 38%, and muscle thickness by 8 to 9%. What makes the sit-to-stand so practical is that it mirrors a movement you already perform every day, getting up from a chair. It places heavier demand on the hip extensors compared to a standard squat, which tends to focus on the knee extensors. All you need is a sturdy chair. Second, the Otago Exercise Programme, which stands as the gold standard for fall prevention. Developed in New Zealand and validated across dozens of clinical trials, this home-based program combines lower limb strengthening with balance exercises and walking, all individually prescribed. The program works by improving proprioception, your body's ability to sense where it is in space, which is the key mechanism behind why balance training prevents falls. A 2024 meta-analysis covering 13 randomized controlled trials and over 2,400 participants confirmed gains in balance, lower body strength, and mobility. Original research on the program showed a 35% reduction in fall rates and an association with reduced mortality at 12 months. Specific exercises include heel-to-toe walking, single-leg stance holds, calf raises, and progressive resistance movements. Third, resistance band exercises. A systematic review and meta-analysis in the Journal of Clinical Nursing found that band-based exercise for frail older adults reduced frailty after 24 weeks and reduced depression at both the 12 and 24-week marks. A separate meta-analysis focused on chair-based resistance band exercise documented positive effects across all physical functioning measures, sleep quality, and depression in long-term care residents. Another analysis of 19 studies found elastic band training produced measurable gains in functional reach and timed up-and-go scores. Bands cost almost nothing, fit in a drawer, and let you adjust difficulty by swapping to a different tension level. Fourth, targeted individual exercises that fill specific gaps. Calf raises performed twice a week for 5 weeks produced measurable improvements in calf strength, functional performance, balance, and balance confidence. Glute bridges activate the glutes and hamstrings through hip extension without loading the knees, and the supine position removes any fall risk during the movement. Step-ups challenge the quadriceps, hamstrings, and glutes while building coordination. Wall sits reduce incorrect knee pressure compared to free squats and carry endorsements from clinicians treating knee osteoarthritis. One finding from the research deserves emphasis. The 2025 APTA Geriatrics Clinical Practice Guideline on Fall Risk Management established that resistance training prescribed alone does not adequately reduce falls. Multi-component exercise, meaning balance combined with strength combined with endurance, is what the evidence supports. Clinical evidence from the National Strength and Conditioning Association and the American College of Sports Medicine supports a 4-phase progression for building leg strength safely after 60. Phase 1 spans weeks 1 through 4 and focuses entirely on bodyweight or chair-assisted exercises. One set of 8 to 10 repetitions per movement, with the priority on learning correct form. That means sit to stand from a sturdy chair, wall-supported calf raises, and glute bridges on the floor. Phase 2 covers weeks 5 through 8, where you move to 2 sets of 10 to 12 repetitions and introduce light resistance bands. Glute bridges gain a band above the knees, and seated leg extensions with a band enter the rotation. Phase 3 runs from week 9 through 12. Volume increases to 2 to 3 sets of 10 to 15 repetitions. Band tension goes up, and the exercise menu expands to include step-ups using a low step, timed wall sits, single-leg balance holds, and heel-to-toe walking. Phase 4 begins at week 13 and continues indefinitely. Options include a weighted vest for sit-to-stands or a leg press machine if you have access to one. Load targets move toward 70 to 85% of estimated 1 repetition maximum. A power component enters here too, meaning faster upward movements paired with slower controlled lowering. 2 to 3 sets of 1 to 2 multi-joint exercises per major muscle group, performed 2 to 3 times per week, with rest periods of 1.5 to 3 minutes between sets. That is the NSCA position statement recommendation. For power development, they prescribe moderate intensities of 40 to 60% of 1 repetition maximum at higher movement speeds. Vitamin D supplementation also deserves attention here, as the CDC Study Guidelines and American College of Sports Medicine both recommend adequate vitamin D levels for muscle protein synthesis and fall prevention. Many older adults are deficient, and this simple intervention can amplify the benefits of your exercise program. One practical update worth knowing: the 2025 American College of Sports Medicine Guidelines introduced a concept called repetitions in reserve as an alternative to percentage-based programming. Rather than calculating exact load percentages, you stop each set with 0 to 3 repetitions left before failure. That approach works especially well for older adults because it eliminates the need for 1 repetition maximum testing, which carries its own risks. It is never too late. People tell me they are too old, too weak, too far gone to start. The research paints a completely different picture, and the numbers border on unbelievable. In 1990, Dr. Maria Fiataroni Singh published a study in JAMA that overhauled everything the medical world thought about exercise and aging. 10 participants in their 90s completed an 8-week high-intensity strength training program and averaged a 174% strength gain. Her 1994 follow-up appeared in the New England Journal of Medicine and tracked 100 frail nursing home residents with a mean age of 87, who reached a 113% increase in strength after just 10 weeks. A separate published case report documented meaningful strength and mobility improvement in a 105-year-old woman using high-intensity resistance exercise. Dr. Roger Fielding of Tufts University explained the mechanism behind these gains. His words were that when you do resistance or strength training, Very important chains of molecules that relay signals between cells are affected, and these changes linger in the body for hours after exercise, building up a cumulative positive effect. Even a low-intensity strength and walking program delivers benefits, according to research from the National Institute on Aging. Gains arrive faster than almost anyone expects. Studies indicate a 70-year-old can restore maximal muscle strength to the level of young individuals after only a few weeks of consistent training. Early improvements come from neural adaptation, your brain learning to recruit existing muscle fibers more effectively, while actual muscle growth follows over time. A concept called anabolic resistance plays a role here too. Aging muscles respond less readily to protein and exercise, which means older adults need roughly 68% more protein per meal, about 40 grams compared to 25 grams in younger adults, to maximally stimulate muscle protein synthesis. Expert consensus currently recommends at least 1.2 grams of protein per kilogram of body weight per day for older adults, rising to 1.5 grams for those training regularly. Combining resistance exercise with adequate protein intake helps break through that resistance. Dr. Stuart Phillips of McMaster University put the broader picture into perspective when he stated that nobody has figured out how to dial back aging yet, but the difference is between being on a steep downward trajectory versus a much shallower trajectory. And those folks who lose muscle slower as they age do a lot better later in life. A review in the Lancet Healthy Longevity went even further with its conclusion. Taking into consideration current evidence about the benefits of exercise for frail older adults, it is unethical not to prescribe physical exercise for such individuals. How to test yourself at home. A simple test you can perform right now will tell you where your leg strength stands. It is called the 30-second chair stand test, developed by researchers Roberta Rickley and C. Jesse Jones and now incorporated into the CDC Fall Prevention Toolkit. Sit in a standard chair about 17 inches high with your arms crossed on your chest. Then stand up fully and sit back down as many times as you can in 30 seconds. For men aged 60 to 64, the normal range lands between 14 and 19 stands. Women in the same age range typically complete 12 to 17. At 70 to 74, that range shifts to 12 to 17 for men and 10 to 15 for women. By 80 to 84, men average 10 to 15 stands while women average 9 to 14. Older adults who take more than 15 seconds to complete just 5 sit-to-stand repetitions are nearly 3 times more likely to die earlier and 84% more likely to face hospitalization. This test costs nothing and takes half a minute. If your number falls below the normal range for your age group, that is not cause for panic. That is your starting signal. You now know exactly what to do about it. After 60, your legs shed strength at roughly 3% per year, driven by muscle atrophy, fast-twitch fiber destruction, and declining muscle quality. That decline directly forecasts your risk of falling, losing independence, and dying earlier than you should. Standard squats, while effective for healthy individuals, bring joint stress, balance risk, and biomechanical challenges that rule them out for many seniors without modification. But safer alternatives with strong clinical backing exist. The sit-to-stand exercise, the Otago Exercise Programme, resistance band training, calf raises, glute bridges, step-ups, and wall sits have all been validated in trials enrolling older adults. Every major health organization, the CDC, the WHO, the American College of Sports Medicine, and the National Institutes of Health, converges on the same recommendation. Strength training at least 2 days per week, hitting all major muscle groups, combined with balance training. No gym membership required, no expensive equipment needed. A sturdy chair, a resistance band, and the decision to begin. Dr. Maria Fiataroni Singh proved that 90-year-olds can nearly triple their leg strength in 8 weeks. You can absolutely do this. If this video helped you, share it with someone you care about, because every share could prevent a fall. Subscribe for more evidence-based health content built for adults over 60. Thank you for watching. Take care of your legs, because they are carrying you through the rest of your life.